Hello and welcome. My name is Stacy Biddle. I'm career facilitator at Goodwill Columbus in the Workforce Development Department. Thank you so much for joining us today. Remember that the Goodwill Columbus Workforce Development Department is your free resource for everything job related. If you want to update that resume, sharpen up those interview skills, looking for training for a new job or your next best job, we can help. Please make sure that you contact us at the information right there at the bottom of your screen. You can send us an email, you can send us a text, you can send us, or you could call us, or even send us a message on Facebook. We will connect you with a career counselor. All right, so thank you very much again for joining us today. We are going to talk about what to do if you have COVID. If you've gotten COVID or maybe someone in your house has contracted it, what do we do? And then we'll talk a little bit about the vaccine as well. So I am going to bring up Miss Holly. Thank you very much. She also works at Goodwill. So please introduce yourself and your title with us.
Hi, my name is Holly Hunt, and I am the nurse manager for the ADS and WCS programs.
Great. Thank you so much. And can you tell what ADS and the other one you said? I forgot.
Sure, yeah. That's our adult day program that we have that's based in different parts of Franklin County, and then Work and Community Services is over here in Groveport, and that's where my main work area is.
Great. Well, thank you so very much. And so let me ask you some questions. What are some tips for those who currently have COVID? How can they take care of themselves and manage their COVID systems at home?
Yeah, that's a great question. So if you've already been diagnosed with COVID, you've obviously been in contact with some kind of healthcare provider. And the best recommendations are to follow what that healthcare provider has told you to do. So these are going to include things like resting. When we're sick, our body needs lots of rest to recover. Drinking lots of fluid. Sometimes you're going to have a fever, so that's going to increase the need for you to take different fluid in your body. And then sometimes they might recommend something for pain relief, but that really would be up to your specific provider to provide that advice. You really want to follow the isolation guidelines that you received from your healthcare provider and the guidance from your local health department. You want to make sure that you're looking for emergency warning signs in the person who has COVID-19, and you want to seek medical attention immediately if you see trouble breathing, persistent chest pain or pressure, new confusion, if the person's lips turn blue, and the inability to stay awake. There's a lot of things that are happening inside the person's body that or in your body that you might not be aware about and can go really wrong really quickly. So you'll want to go to the emergency room for those type of things. When you are diagnosed, you want to stay home for the isolation period, and it seems like it changes every week. So I'm not going to say how many days that is. Just do what your healthcare provider has instructed you to do. When you live with other people, like maybe you have COVID or they have COVID in your home, you can't isolate safely. You just kind of have to get really creative about it. So you want to make sure that you are so say you have it, you want to stay in your room or get a room or space that is just specifically for you to be in so you can stay away from others. If you can have your own bathroom, that's great. Not everybody has that ability though. So then it just becomes a lot of cleaning. You're going to want to wear your mask whenever you're not, even if you're in your own home, but if you're around other people who don't have COVID, you want to wear a mask when you have to go out of your space, and then just cleaning. So, you go to the kitchen, you make some food, you're going to clean all the surfaces that you touched, and then you're going to go back to your room and eat the food in there. So you can isolate alone in your own living space, and then you just want to clean as much as possible. They suggest separate plates. So you're going to have your own special plate, your own special cup, your own special dishes, and those are the ones that you use, that you wash, and other people keep separate. If a person needs more care than that, you're going to want to wear gloves if you're the caregiver, which is kind of weird to say for a loved one, but we really have to protect ourselves so we don't get COVID, so we can continue to care for this person. If you have to change bed linens, like to hold those away from yourself when you're walking to the laundry room, wash everything in the hottest temperature possible. and then dry things in the hottest temperature possible as well, really just to kind of clean the germs and keep things safe and tidy around the house. And then washing your hands for at least 20 seconds. That's going to be always preventative for everything.
All right. That was some information I've not heard of, like about the plates and all of those things. So that was very helpful. Thank you. I would never thought of that ever. So that's great advice. My second question, I think you've already hit on it, but I'm going to ask it just in case you want to add anything else. When we have someone that we live with contract COVID, how can we take care of them while taking care of ourselves and our family? I think you've already touched a lot on that, but was there anything else you wanted to add?
Yeah, the main thing is just to be really careful because, we might live with others who could contract it and be more sick than us. Like we might just have like a little bit of illness. So we're like, oh, we're totally fine. But especially if you live with somebody who's older or maybe immunocompromised, they could get much, much sicker. So, and it just seems like everybody has a completely different experience with this. So even if you're not super sick yourself, you want to really have those good isolation precautions in place and follow those so that your other people that you live with don't get sick because they could get it much worse than you.
Okay. Thank you. So I want to ask about the vaccine right now. What do you know about how can someone go about getting that? How's that working right now in our state?
Yeah, so it's quite confusing, and I've spent some time trying to get a good answer for you, and they don't have one yet.
That's what I thought.
They did announce, so they're doing different phases. In phase 1A, I did actually write it down so I could kind of help remember it. Getting the vaccine, it's healthcare workers, nursing home, assisted living. It's those kind of people that they've put in high priority. So if you have any of those types of jobs, and I really suggest that people go to the ohiocoronavirus.gov website. They have like so much information on there. It's high quality stuff. And that's going to give you all of the most up-to-date information. So, and they have that list for the phase 1A people who can get the vaccines. So that's going on right now. And then 1B, actually, they've announced dates today, but I haven't committed them to my memory yet. So the 1B people, that includes individuals who are 65 and older.
Okay.
And they've broken it out. This week, these people can get it. This week, these people can get it. Now, where they can get it, they haven't announced that yet.
Okay.
They were talking about doing drive-through clinics, which would be, increase the speed, hopefully, of doing things, and then also reduce the distance between people, because if you're in your car, you're not going to be around any other people. And then also adults who work in schools.
Right.
So, and then other developmental disabilities you might have from birth, those are in the phase 1B.
Okay.
So I recommend if you work for an agency that you fit into one of those type of employees, you talk to the agency, you can call the health department. There's a lot of kind of internal contact going on about those type of things. And then as far as if you're 65 and older, again, they haven't announced the specifics of that yet. They might have done it this afternoon, but I haven't seen anything prior to this.
Right, it changes every day.
Yeah, it really does. It really does change every day. And it's really important that people are checking every day and seeing kind of what the updates are and what the advice is, because it's changing very quickly. Yeah. But the other important thing about the vaccine is when it's your turn, get it.
Okay.
Like make your decisions now and get it, because more people are deciding to get it, which is great. But those spots are filling up, and they're not able to get appointments because there's just so many people who want to get it now, which is great. But just be persistent when it is your turn, and patient, and just get it, figure out a way.
Okay, good. Thank you for that. Clarifying as much as you can, as much as you know. We'll watch today and something will change. All right. What is something about the pandemic that you really wish people knew?
Yeah, I really wish people, I have two things. The first is like to find reliable sources. Like I got all the information today from Mayo Clinic website. That was kind of the new one that I went to, but all their information lines up exactly with what I see on the Ohio Department of Health website and the CDC website. I just kind of wanted to try a new source just to give people another option. So, you want to make sure that it is I see lots of stuff on Facebook,
Mhm.
but I also am like, okay, what is this story about? Who is the source? So you want to look for that. And then just also like a lot of what we're doing is for ourselves to keep ourselves safe, but other people as well need to be kept safe by our actions. So like wearing the mask, doing the social distancing, getting the vaccine. Like I don't do those things for myself necessarily. Like I do them for people I know who are immunocompromised.
Right.
I do them for people's grandparents who, might not have access to get the vaccine yet. So, to help protect other people. Like I've had kiddos in my family who've been pretty sick. So they wouldn't have been able to get the vaccine. Well, kids can't get it. So all the kids, we're doing it for all the kids. So just to help other people. So our actions affect other people. And I think some people don't understand that. And I would like them to know that, to think a little, more broadly.
Right. Thank you.
Mm-hmm.
Well, do you have any other final advice for us?
I do. I missed a section that I did about caregiver stress when somebody is taking care of somebody who has COVID, and then also just self-care for ourselves, just to kind of create a daily routine. Showering, getting dressed, those are 2 victories. If you do those 2 things, that's a win. Taking breaks from COVID news. I know that's what we're doing right now is COVID news, but the news, like I don't watch the news. I only look at Facebook a very limited amount of time. I have rules around that. Eat healthy, exercise, get plenty of sleep. I saw the sunshine out today, go outside for a little bit, get that fresh air, and then try to connect with people as best as you can during this time.
Well, thank you very much for joining us today. And I'd like to say thank you to everyone who tuned in today. And remember that Goodwill Columbus Workforce Development Department, again, is your free resource for everything career related. And you can contact us with our information scrolling at the bottom of the screen. And we will see you again. Thank you.